Well, tonight, the public relations firm hired by two bankrupt Hawaii hospitals said 500 workers were laid off last week. Now, that is more than half of the 990 workers employed by Hawaii Medical Center East and West. Now, last week, Becker Communications issued a statement saying the first wave of terminations affected, quote, more than 200 employees. Now, when KITV pressed for actual numbers, we were told 500 letters were sent out to everyone, from technicians to nurses. KITV4's Catherine Cruz has been tracking this story and takes a closer look at the ripple effect the closure is having on the medical community, particularly the nurses.
Chaminade University recently launched a new nursing program with an education center equipped with mannequins that blink and bleed. It's part of a statewide effort to build a nursing pool for an anticipated nursing shortage in 2015.
About 600 new graduate nurses are added to our supply of nurses every year.
That's been the trend over the last 5 years. Now it seems there's a mini glut of trained nurses hitting the job market. And with close to 400 experienced nurses losing their jobs, administrators say it will add to the difficulties of new nurses.
There are still probably not as many openings in the community for new graduates as there are for experienced nurses.
Timanak says the new nurses may have to wait up to a year to get that first RN job locally. Hawaii Pacific University, which has the largest program in the state, and the University of Hawaii used to send their nurses to HMC East and West for clinical training. They now have made arrangements for their students to be placed at other settings in the community for the spring. Timanak says the loss of HMC nurses is still a large number to absorb for a community of our size, and she's hopeful the experienced nurses will find employment soon.
Nurses work in long-term care, they work in home health, they work in clinics, they work in hospice, so there are many opportunities if they're willing to look at different settings as well.
Right. At the same time, she laments.
It's a big loss. It's a big, big loss.
Now, no word on when the second wave of layoffs will come. The hospital has been said to be aggressively trying to place the last remaining patients, and those close to the situation say the shutdown could come in the next week or so. Back to you.
All right.